Hello everyone, welcome to my YouTube channel. Today our topic is shoulder joint. This picture you can see a shoulder joint. You have to know first the type of the joint. What is the type of the joint? Shoulder joint is a synovial ball and socket joint. The articular surfaces of this shoulder joint are it articulates with the head of the humerus and the glenoid cavity of the scapula. Actually, this head of the humerus is one third of a spear, therefore, it is little bit large than this glenoid cavity. Therefore, this glenoid cavity is deepened by the fibrocartilaginous ring. It is called as glenoid labrum. This is the fibrous capsule of the shoulder joint, which we can see as the outer layer after removing the muscles around the shoulder joint. This capsule is loose and it is attached around the epiphyseal lines of the glenoid cavity, and humeral head. Inferiorly, this capsule extends down to the surgical neck. Therefore, if there is osteomyelitis in the upper end of the humerus, it can also spread to the shaft of the humerus. Here you can see after removing the capsule. We can see the synovial membrane of the shoulder joint. This synovial membrane is attached to the margins of the articular surfaces. It attached to the margins of the articular surfaces and lines the fibrous membrane of the capsule. Also, this synovial membrane involved in formation of various bursae related to the shoulder joint. In this picture, you can see those bursa. There is subacromial bursa. This is the subacromial bursa, and this is the subdeltoid bursa. It is underneath the deltoid muscle. This is subcoracoid bursa, underneath the coracoid process, and this is the subscapular bursa. There are four main bursae around the shoulder joint. You have to know these things. There are several ligaments that strengthen the shoulder joint. These are those ligaments: acromioclavicular ligament in between acromion process and clavicle, and coracoacromial ligament in between coracoid process and acromion process. This is coracohumeral ligament in between coracoid process and humerus. This is conoid ligament. This is the conoid ligament, and this is the trapezoid ligament. Those conoid ligament and trapezoid ligament attached to the clavicle, inferior surface of the clavicle. And this is the transverse humeral ligament. This is the transverse humeral ligament. This transverse humeral ligament is between greater and lesser tuberosities of the humerus. It strengthens the capsule and bridges the gap between the tuberosities. This is the gap between the tuberosities, and it strengthens this gap. These are the main muscles around the shoulder joint. These muscles are called as rotator cuff muscles. This is the major component of joint stability of the shoulder joint. To these rotator cuff muscles, there are four muscles include subscapularis muscle, supraspinatus muscle, infraspinatus muscle, and teres minor muscle. Out of these four muscles, supraspinatus muscle, infraspinatus muscle, and teres minor muscle attached to greater tubercle of the humerus, while this subscapularis muscle is attached to the lesser tubercle of the humerus. And also there are another muscles around this joint. They are triceps brachii muscle and biceps brachii muscle, deltoid muscle, latissimus dorsi muscle, and teres major muscle. This is the teres major muscle, this is the latissimus dorsi muscle, and this is the deltoid muscle. Then we are going to learn about the movements of the shoulder joint. These are the movements of the shoulder joint. First, abduction. Abduction is the one that goes away from the midline. Away from the midline. Initial 15 degrees abduction is done by supraspinatus muscle, then up to from 15 to 90 degrees abduction is done by the deltoid muscle. Beyond 90 degrees abduction is done by, beyond 90 degrees it is done by the rotation of the scapula by trapezius and serratus anterior. Then the adduction of the shoulder joint is done by pectoralis major muscle, latissimus dorsi and subscapularis muscle. Flexion of the shoulder joint, this is the flexion. This flexion of the shoulder joint is made by pectoralis major muscle, deltoid muscle, biceps brachii muscle and coracobrachialis muscle. Then extension of the shoulder joint is done by triceps brachii muscle, teres major muscle, latissimus dorsi muscle and deltoid muscle posterior fibers. Then medial rotation. This is the medial rotation, medially rotation. This medial rotation of the shoulder joint is done by pectoralis major muscle, latissimus dorsi, teres major, deltoid anterior fibers and subscapularis muscle. Then the lateral rotation. Lateral rotation of the shoulder joint is done by infraspinatus, teres minor and deltoid posterior fibers. Then we have to talk about the blood supply of the shoulder joint. Blood supply to the shoulder joint is given by the various branches of major blood vessels around this shoulder joint. It includes suprascapular vessels, subscapular vessels, circumflex humeral vessels. Nerve supply also like that. Any nerve which pass any joint, then those nerves gives nerve supply to that particular joint. Those as this shoulder joint get nerve supply by axillary nerve, subscapular nerve and lateral pectoral nerve. Then finally we have to discuss about the dislocation of the shoulder joint. It means clinical aspect of the shoulder joint. Most commonly dislocated major joint is the shoulder joint because it is somewhat unstable. First, when it is dislocated inferiorly, first it goes into subglenoid position. Acromion becomes the lateral most prominent structure. In normal person, the greater tubercle of the humerus is the lateral most prominent bony projection seen in X-rays. But here, when there is shoulder dislocation, this acromion process becomes lateral most prominent structure. Then it goes into subcoracoid position as seen in this picture. This is due to strong flexors and adductors pull the humerus forward and upward. Strong adductors and strong flexors, they pull the humeral head forward and upwards. Here, axillary nerve can be damaged because axillary nerve goes around the surgical neck. Due to damage of the axillary nerve, there can be wasting of deltoid muscle, then destruction of the normal contour of the deltoid muscle we can see. And also there is sensory loss in the upper half of the arm. It means around the insertion of the deltoid muscle. So that's all about shoulder joints and its clinical aspect. Thank you for watching.